All kinds of men come to Nova Medical for their hair restoration, and people from all different races, different backgrounds, different hairstyles. And here's a case of an African American patient that came for restoration with typical male pattern hair loss. So let's take a look. Take a look at the temporal areas. There's a lot of recession there. It has a bit of a widow's peak that has also receded a little bit on either side. Just the very centralmost portion is preserved, and that also appears to be thinning. Now, with not a lot of hair, 2,500 grafts, we've got a really nice restoration here, but there are some things that you have to keep in mind for African American patients that are different from Caucasian patients. Now, African American hair doesn't tend to grow straight and smooth. It tends to be a little bit spiral in its growth, and so you can't rely on the direction of the hair coming out of the scalp as being the absolute direction of the follicles. It takes a lot of experience to be able to harvest those follicles and make sure you're getting the full follicle and not damaging it as you're trying to harvest it. You also have to be careful how you're placing it to get the maximum scalp coverage. And with the curly hair as it grows, actually it covers the scalp better. So that's a nice benefit. And typically it grows very dark. So having dark curly hair as it comes in will cover more scalp and require less grafts. Even though this patient had a lot of recession, only took 2,500 grafts to get a great result. If we take a look at the result, you see this squared off hairline with a little hint of that widow's peak that he had from the beginning, and a really thick, lush growth of the newly restored hairline. So here is a great result with kind of on the lower end of the number of hairs that we would normally use for a restoration like this, with a great result in an African American patient.